In our previous video, we've gone over what original Medicare Part A and Part B covers. Now let's look at what it doesn't cover. Many people are surprised to learn that they will have out-of-pocket costs which could be quite high depending on individual healthcare needs. Further, there is no out-of-pocket maximum, no financial protection with original Medicare. A serious illness or injury could create real financial stress. Again, if you need certain services Medicare doesn't cover, you'll have to pay for them yourself, unless you have other insurance that covers them or you have a Medicare health plan that covers them. I will talk later about ways that will help you cover whatever Medicare doesn't. Another possible surprise is that original Medicare does not cover prescription drugs, which can be a big expense as we get older. Other non-covered services include routine dental, vision, and hearing care, as well as any corrective treatments. Long-term care such as nursing home, custodial care, which includes bathing, eating, and dressing, and may be called activities of daily living, ADL. Or care received outside of the U.S. except in certain circumstances such as emergency care. The good news is that there are some options that may help with those non-covered items. But first, let's talk about Medicare costs. We'll start with some definitions. Most people are familiar with premiums, deductibles, and copays, which are defined on this slide. Coinsurance may be a less familiar term. It's an amount you pay when the cost of a covered service is split with you. It's determined by percentage. For example, the cost of a service is covered at 80% and you pay the remaining 20%. You may have some or all of these types of costs with Medicare, again, depending on your coverage. Here are the basic costs for Part A. There is no Part A premium for most people, as we discussed earlier, but you'll pay a deductible if you go into a hospital. This covers up to 60 hospital days in one benefit period. If your stay is longer, you'll pay extra for each day over 60, up to a total of 90 days. After that, you would need to tap into the up to 60 lifetime reserve days we talked about, which will have an extra cost per day. Each year, the figures change. I will try to update the information accordingly. If you are watching a recording of this presentation, please consult with your agent or get an update on the current year costs with us. If you don't have an agent, feel free to reach out and we can provide this information with no obligation. Let's look at an example to see how Part A costs might play out. Let's say that this is John. John has 2 hospitalizations in 2 separate benefit periods. He pays a deductible for the first stay and the same amount again for the second stay. As an aside, if John had been readmitted less than 60 days after his first discharge, the second stay would occur within the first benefit period and he would pay just 1 deductible. John's second stay extends past the 60-day mark covered by the deductible, so he has a per day cost for each day over 60. He stays 5 more days. John would likely be responsible for other costs too, notably a share of his doctor fees, which would be partially covered by Part B. Moving on to Part B, there is a monthly premium and an annual deductible for Part B. The deductible and premium changes every year, and I will try to update this video accordingly, so please make sure to subscribe and stay up to date on the updates. Okay, so as I mentioned, there is an annual Part B deductible. After the deductible is met, you are responsible for 20% of the cost, which is a coinsurance for most Part B services. You are also responsible for excess charges, if there are any. Excess charges are additional amounts that may be charged by providers who do not accept Medicare assignment. Providers who accept assignment agree to take Medicare's payment as payment in full. There is no out-of-pocket limit with original Medicare, as I mentioned, and that's a risk many try to avoid by getting a Medigap or a Medicare Advantage plan. Here's an example to help understand how Medicare assignment might affect the cost of a doctor visit. Maria's doctor charges $300 for a visit. The amount Medicare approves is $220. If the doctor accepts assignment, Medicare Part B pays 80% of the approved amount, which is $176, and Maria is responsible for paying 20%, which is $44. If the doctor doesn't accept assignment, Medicare reduces the approved amount by 15% to $209. Medicare Part B then pays 80% of the reduced amount, $167, and Maria is responsible for paying 20%, which is $42. In addition, Maria must pay the doctor's excess charges. Again, the formula is 15% of the reduced amount, which comes to $31. Maria's total cost would be $73. The dollar amounts in this example are fairly small, but the difference in Maria's cost is significant. Imagine what it would be for an expensive procedure. When we're talking about percentage, that could be quite high. It's always a good idea to ask providers if they accept assignment before receiving services, so you're not surprised with a bill later. So even from these simple examples, you can see that out-of-pocket costs with original Medicare can take a bite out of your budget. And we haven't really talked about the cost of prescription drugs yet, which are not covered by original Medicare. The good news is that you have options for other coverage that may help turn that bite into a nibble. Now, we're going to see how Part C, Part D, and Medicare supplement insurance fit into the picture. You have two options for more coverage. Option 1 is to add Medicare supplement insurance and Part D prescription drugs plan to original Medicare, or option 2 is to choose a Medicare Advantage plan Part C. Many plans include drug coverage and additional benefits. Before we discuss in detail these options, I want to point out that all three of the components shown, Medicare supplement insurance Part C plans and Part D plans, are offered by private insurance companies. What this means is, in part, is that there may be a number of plans to choose from, and they may vary in coverage and costs. And by contrast, original Medicare is administered by the federal government, and benefits and costs are the same for everyone. Medicare Advantage and Part D plans are approved by Medicare and held to standards set by Medicare. These private plan options are provided to give you more choices and the ability to fill in for what isn't covered by the original Medicare. We'll circle back to this graphic later. Some people with low incomes may qualify for programs that reduce their Medicare-related costs. There is extra help for prescription drug coverage and some state-run savings program that can help with copays, coinsurance, deductibles, and premiums. For those who don't qualify, paying out-of-pocket or buying additional insurance are there other options. Feel free to reach out to us and we can go over various plans and costs that will pick up what Medicare doesn't cover, and most importantly will set an out-of-pocket maximum that will protect you financially. In the next video, I will talk about the Part C Medicare Advantage and Part D prescription drug plan coverage. So please make sure to watch the next video for in-depth details about Medicare Part C and D.